Welcome back to Body Beautiful. We're going to be taking your calls. We have quite a few of them, so we're going to try to get to them quickly. Any questions you have for Dr. Mele about plastic surgery, the number 800-440-4884. We're also going to be putting his own number up for his office during the segment, so be ready to jot that down. And our caveat, make sure you get a second opinion no matter what we tell you here today. Dr. Mele is a great doctor, but always a good idea. Let's show some of the before and after pictures. Go ahead and flash those really quickly. What are we looking at here? Oh,
this is a procedure that tightens the skin on the arm, and another frequent area that gets addressed after massive weight loss. It does leave a scar. You can just barely see it along the inferior aspect of the arm. The lower part of the arm there extends from the elbow to the armpit. But when someone has this much extra skin, again, there's no other alternative treatment. There's no way to shrink that skin up adequately.
No amount of bench pressing is going to make that go the other direction, right?
No matter how strong your triceps are, the skin would still be loose.
Okay. And that brachioplasty, is that
That's a brachioplasty, yeah, an arm lift.
All right. It looks like they got some tan on there, too, so that also probably helps.
I think they were happy to show their arms afterwards.
Sure.
So.
Oh, exactly.
Yeah, it works.
Okay, we've got Stella from San Jose on the line. Good morning, Stella. You have a question for Dr. Mele?
Yes, I do. I've needed a tummy tuck for years. I've never had the money, and I've always been afraid of the risk. However, I've come to the point where I just don't want to wait anymore and want to at least have some time in my life where it looks good. 60 years old, just wanted to know about the risks and also maybe a price.
Sure. The risks are the same as with any surgery. The most common things we worry about, around the time of surgery, things like infection and bleeding. But as we get older, we tend to accumulate some other medical problems. So if you have any other medical problems, certainly you want to be sure those are well controlled. And what I normally do in this situation is anybody who's over about 50, it's sort of an arbitrary age, do a little bit more of a medical workup, have you see your primary doctor, let them know what we're up to, make sure that an anesthetic would be acceptable, because with a tummy tuck, you need to have general anesthesia. There are risks from general anesthesia. There's other risks from the surgery, but if we can control those things that you bring with you, the other medical problems, then they tend to be minimized and they tend to do well. In terms of the cost of a tummy tuck, it varies tremendously depending on how much we're removing, how long it's going to take. In terms of keeping you overnight, can be anywhere from $5,000 to $10,000 and more. But it just depends on your specific needs and how much we're doing and how long it takes.
So she says that she's 60 years old. Is that considered mid-range in the scale of ages where these procedures are being done?
For tummy tucks, we tend to do them at a younger age because they do tend to be associated with weight loss or with pregnancy. And most people, by the time they're 60, either have done it or decided not to. So we tend not to do it as much in the older age group. But it happens. I did that just a couple weeks ago. Patient did very well because we took the care and did things the right way.
All right, Stella, hopefully that answered your question. Let's move on to Kimberly from Hayward. Good morning, Kimberly.
Hi. I'm trying to get rid of the baby pouch, and I do work out, and I was wondering if it would be necessary for someone like me to get plastic surgery, or is it something that could be worked off by working out?
Sure. Well, plastic surgery is always elective, so it's never necessary. It's something that people choose to do because other options weren't working and they feel the benefit is going to outweigh the small risk that there is. If you are working out, you're in shape, if you've given it enough time, then it will improve somewhat, and you've probably seen some improvement already. In terms of how much improvement is enough, that's, again, it's up to my patients, and I let them decide after we discuss what's involved in order to take the next step, if it's a worthwhile thing to do.
Okay, thanks, Kimberly. The baby pooch.
The baby pooch.
A lot of us fight that. Do you get to a point too where you just say, "Hey, learn to love it"?
I got a baby pooch too. It's not fair.
They call them love handles.
Yes.
So.
Well, I had sympathy weight gain.
Okay. Okay, good. Let's try to squeeze in one more call here. Jessica from San Francisco. Good morning, Jessica. You have a question?
Hi, I wanted to ask about liposuction and is there after effects like lumpiness that happens? And if so, does it happen often, and does it go away, and what causes it?
Sure. Liposuction basically is a way to vacuum out the fat that's between the skin and the muscle. And if we have a good muscle behind it, then if there is some irregularity in the fat when it's removed or how it heals, sometimes there will be lumps and bumps. Usually they're temporary. Most of them will feel for a few months, maybe 3 months, 6 months, and then they go away. Once in a while they will remain. And if they remain, it may require additional treatment in order to get rid of that, whether that be a little bit more liposuction in the areas that are still full, or occasionally if it's removed remove too much, we have to put a little bit fat back in order to smooth it out. So it is treatable, but it's not the most common thing that happens.
So, Doc, what about this micro liposuction, you know, with lasers or with other, very quickly, we only have about 30 seconds, but.
Sure, there are a lot of modalities that are being added on to basically a tumescent procedure or alternatives such as where they're injecting to try and get the fat to melt away. It's not really recommended by the aesthetic societies at this point because it's not predictable in terms of how much will go away. And the volumes that are treated tend to be smaller volumes, and it requires multiple treatments to get similar results.
Okay, well, you know, as you showed the picture there was someone who really looked pretty good. Now, obviously, you know, the before and after, they had a completely flat stomach, but again, it's subjective. It's, you know, what you feel comfortable with.
That's right. There's no right answer.
Okay.
It's what you're comfortable with, exactly.
Right. Well, thank you. We have run out of time. I couldn't take the rest of the calls because, you know, we're short on time, but we're going to have you back, obviously.
All right.
For more information about Dr. Joseph Mele, you can call 925-943-6353 or go to drmele.com. Join us tomorrow at 11 a.m. for yet another edition of Body Beautiful. Thank you so much for joining us, Dr. Mele.
Always nice to be here.
Everybody, have a great day. Bye-bye.